My name is Angela. It is October 3rd. And we're doing the trach suctioning. So first we're going to gather our supplies. I'm going to do hand hygiene. Get the PPE that we need, which is gloves, mask, shield, gown. Okay. Have our patient here. This is Barry. So we're going to ID the patient, name, date of birth, if he's able to tell us, look at the bracelet, look at the room, look at the chart, make sure everything coincides. If there's a door or a curtain, you close the door or the curtain. If there's any pain medication that needs to be administer at least a half hour to an hour before, so it kicks in before you do it. And you want to explain to the patient why you're suctioning, whether they're alert or not alert. You're going to adjust the patient as well to the position. Okay, and you want to put a waterproof pad over their chest underneath their trach in case of any secretion is dropping off. We're going to adjust the suction to no greater than 150, between 125 and 150, depending on what the order says as well. We would put gloves on and we would check the suction to make sure it's working, if it's in the wall or the machine that is portable. So we're going to go ahead and get started. So open this up. I would hand pump, hand hygiene. Open this up this way. And now we want to do pour our saline into it. So we're going to grab the box by the outside. It pops open. And that's what the saline is going to go into. We're going to put on our face shield and mist. And then we're going to put on our sterile gloves. So this would remain all sterile, but I need to put this down so you can see it. So we'll put it right there. You want to touch as little as possible when putting these on. You want to make sure your hands stay above your waist. My table's a little low. I'm at the dining room table. I can't raise it, but you don't want to drop your hands below your waist. Next, I'm going to get the catheter in my right hand because that is my dominant hand. And I'm going to coil it. And this is where I would take the Y port and connect it. This is my dirty hand, this is my sterile hand. And connect it. So we'll say this is now connected and this is going to be working the Y port. And you can drop that because it is connected. It won't go far. You can drop that at any time. You're going to want to take off any vent tubes that they have the ambu bag, and you want to hyperventilate to give them a little bit of extra, oxygen before you start suctioning them. So we hyperventilate. We want to lubricate this, so we go in the sterile water, and you would intermit the Y port to get it up there. And then you want to go in quick, but not too quick. So you would go in, and then you're going to suction on the way out. And you're going to hit the Y port intermittently and twirl on the way out. And then you're going to hyperventilate as well, again, if needed. And we're going to flush the catheter. Now, if it needs to be done, you would do it again, just in those steps. You would only do it a total of 3 times per episode. Once the trach is all suctioned, then you're going to go ahead and do the mouth to get any secretions in the mouth left, and then you're going to rinse that out. once you were done with that, you do not want to put this back into the trach, so you are all done with this. If you have somewhere to put it, so you can perform oral mouth care, you want to put it there. You don't want to put it on the bed or the table. You want to put it on some type of barrier. So you would put this down and do the mouth care. Then once you're done, you want to coil this up in your glove, and you're going to remove the glove inside out, and it's going to be tucked in your glove. And as soon as you're done, you want to put the bed rails up if you have the bed rails, because you don't want to step away to do anything without safety for the patient. So then you would turn off the, once the bed rails are up, you would turn off the suction, remove the PPE, readjust the patient if they need to be adjusted, and let the patient know that if he needs to be suctioned again, just to let them know and go by the order. You can be suctioned again in a couple hours. We'll do it then, another three pass turn with that. And then ask if there's anything else that they need from you, and, give them the call bell. And that's it. Thank you.